So we are at our second session in the series of exercise for breast cancer patients. So we did the first series, first part of the exercises were very general. So we're going to continue, you can continue with those exercises or move on. So we're going to do a little bit more. So again, make sure that you're in comfortable space. No distractions. This is your time for you for at least 20 minutes. Okay? Let's go. So you're sitting up on a nice comfortable chair. Your legs, I want your legs to be a little wider. Sit up nice and tall. And we're going to start out a little bigger this time. All right, so I want you to bring your shoulders up and bring them back, sticking your chest out as much as you can. We're doing shoulder rolls. Bring your shoulders up. Stick your chest out. Good. Good. Doing great. Breathe. Right back. One more time like that. So relax your fingers. Relax your toes. Good. Now we're going to reverse. Lift your shoulders up and around. Just notice. So it's not just the shoulders, right? It's also the upper back. It's also the muscles that connect with the chest. Also the core muscles or abdominal muscles. All those muscles have been affected. All those muscles work together. One more time. Good. Take a little break. We're going to take a breathing break. Breathe in through your nose and out through your mouth. Allow the chest to rise. Inhale. Exhale. Again. And exhale. Fantastic. Good. All right, so we're going to focus more on the arms and a little bit of the legs today. Okay, so I want you to lift your left arm, bend your left elbow, like this. Just lift that elbow up. Shoulder height. That's all. Bring it down. Okay, just four like that. 1, 2. Now, if you feel you can go a little higher, you go higher. 3, you decide, okay? But it may take time before you're able to go higher. 4, good. Take a little break, other side. You're just waking up those muscles and those joints. There we go. 1, good. 2. So remember, the range depends on you. If you're able to go higher, do it. 3. One more time. 4. Good. And with this, excellent. Good. I want you to bring your hands to the front, make a fist and throw it. Just gentle. Okay? Get the extra blood flowing through the hands. Do 4 more. 4, 3, hardly any movement in the body. 2 and 1. Arms down. Good. Now we're going to go a little bigger with the movement. Okay. Bring your hands forward. Bring your hands, hug yourself. You're just hugging your elbows. And then we're going to open. Just like that. Okay. Elbows are in. And you open it. As you open the door, you notice the elbows are close to the bottom. Arms are close to the bottom. Okay. Do that again. So you could go like this. I don't want you to do that right now. I want you to go gentle. Okay. Open. If you're able to go further, do it. That's fine. Okay. But there's no hurry. As long as you do the exercise, you do it consistently. Let's do 2 more just like that. Just like hug your elbows and open. One more time like that. Hug your elbows and open. Yes, good. Drop your arms. Good. So you may feel that in the front of the plate cuff. You may feel that in the side of your chest. You may feel that in the front. All right, wherever it is, if it's tighter, you may even feel it in your neck, in your abdominal muscles, because everything is connected. Okay, so now I want you to round your shoulders forward. like this. Tuck your chin in and round your shoulders forward, like a slouching over. And then sit up nice and tall. Relax your shoulders. And again, tuck your chin in, round your shoulders forward, slouch over. Tall. Two more just like that. Tuck. Make sure you breathe in. Do not hold your breath at all. Okay? One of our tactics to make sure we breathe in is counting. Okay, because when you're counting, the oxygen is coming in and the carbon dioxide is going out. Let's do that 2 more times and count. So you know how to count when you're doing the exercise. 1, 2, 3, 4, up, 2, 3, one more. 1, 2, 3, 4, up, 2, 3, 4, and next. Excellent. So we're taking care of front and also the back. Okay. And now we're gonna do a little bit more with the range of motion. Okay. So I want you to lean to the left. You're gonna try to touch the floor with the left hand, and you're gonna reach the right arm up. Okay, and we're gonna switch. Okay, so you lean to the left. When you start that lean, you're starting to stretch your sides. Okay. And you lean and you're reaching as low as you can, and you're gonna reach up. All right. Maybe this is where you are. You're reaching down, maybe you can only grab the leg of the chair. All right, and maybe this is as far as you can go with this arm. And then bring it back. Yeah. The other side, just like that. We breathe in and count it. 1, 2, 3, 4, and sit up. We're going to get that blood flowing through the core. Okay. Yeah. Now, if you can go further, you will. If you can reach further down, you can reach higher. That's what you do. If you can do that, do it. But you're not. If you're not there, you don't have to do that. Just do the best that you can. The main thing is to get everything moving. You're either here or you're further. Bring it down. Okay? Good. We're going to do 2 more each side. Okay? And that's one of the good things about Zoom, all right? You're not in competition with anyone else. You just do the best that you can, and you listen to your body, and you notice what it feels like. Okay? So you want to feel a little bit of tension, a little bit of tightness. Okay? You don't want to feel any sharp movements, any sharp pain. If it's sharp, then you're just not going to do it. Okay? And release it. That's all. And pull the shoulders forward. So we're doing active movement through the chest and back. Pull the shoulders back. Now remember the arms. Right now, we're not really using the arms, shoulders, that's what we use. Good, and the core. Do that again, open up. And close. We're gonna do 1 more just like that. Open up. Close. And sit up nice and tall. Good. All right, so we started out with a bang, okay? And we're gonna combine the movements that we did in the first segment with the movements that we're doing now, okay? If it's too much, don't do it. Just stay with the first segment, all right? Okay. All right, so we're gonna do our neck. Put your shoulders back and down. Lean your head to the left, count to 10. 1, 2, slow. 3, 4, noticing. 5, how you feel. 6, you count when you're breathing. 8, 9, and 10. Now you're gonna bring it back to the center. And you're gonna go to the other side just like that. Go. 1, 2, 3, 4, 5, just breathe. 6, 7, listen to your body. 8, 9, and 10. And bring it back to the center. Turn your head to the left. Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. And bring it back to the center. Go in the other direction. Go. 1, 2, 3. Don't move the body and don't rush. 5, this is your time for you. 7, 8, 9, and 10. And bring it back to the center. Good. Let's take a couple of breathers. Inhale. Exhale. Allow the chest to rise. Inhale. Exhale. Very good. Now, rotate all the way around to the left. So we're combining what we did in the last session with this session. Slow, big movements, listening to every part of your body, noticing what it's saying. We're going to go in the other direction. Don't rush it. Don't rush it. Now, before you exercise, you want to make sure that you don't eat at least an hour before. Okay? At least an hour before. One more time. And breathe. Slow, big movements. And in the other direction too. Wonderful. Be pleased with yourself, okay? That you're making this time for yourself. Bring your head back to the center. Excellent. Now, we're going to add the shoulders that we did, okay? So, shoulders back. Now, stick your chin up a little bit. And shoulders forward, so we're combining movements. Do that again. Shoulders back, chin up. Shoulders forward, chin down. We got one more time just like that. Shoulders back, chin up. And shoulders forward, chin down. Perfect. And straighten up. We're going to lean to the side. Reach up with your right arm. So remember, you can either be here, trying to touch down. If you can't touch down, grab the leg of the chair. You're breathing, and you're just working on your range of motion. That's what you're doing. Work on that range of motion. If you can go all the way up, go. If not, just stay there and notice how it feels. Okay? And then go to the other side. Remember, you can do your count. 1, 2, 3, 4, 5, 6, 7, 8, and bring it down. And you don't want to do too much at one time. Okay? Remember, there, grab the elbow, open. Grab the elbow. We're opening up, opening the doors, pulling the arms back enough so you can feel that stretch right there. And do that again. Close and open. Remember, if you can go further, go bigger if you want. Okay? One more time. Close and open. And bring your arms down. Good. Now we're going to slouch over. Slouch. Open. And open. Pull the shoulders back. So this is a big movement. Chin up. Again, slouch over. 1, 2, 3, 4. Open. 1, 2, 3, 4. Do that again. Close. 2, 3. Yawning. 2, 3, and 4. And reset. Good. Be proud of yourself. Be patient with yourself. Make sure that you drink as much water as you can, because oxygen travels through water. Okay, and our bodies are 72 to, depending on your body, 72 to about 80% water in the blood. Okay, so drink water. Don't only drink your water, eat your water too. Eat cucumbers, eat your fruit with a lot of the fruit that's watery fruit, watermelons, you just eat them, okay? Because that counts as water intake also, all right? Okay, good job. See you on the next segment, okay? Be patient with yourself. If you get fatigued, if you get tired, never, ever give up. Just take a break and continue on. I'll see you in the next segment. Bye. We end it.